Let's go to callers.
Let's head to Massachusetts, and Eileen, you're on with Dr. Wallach.
Hello, Eileen, you're on the air.
Hi, Dr. Wallach. I'm actually calling for a friend of mine who has contracted Lyme's disease.
Mm-hmm. Okay.
And I'm looking to see what we could do for him.
Okay. Well, if they have true Lyme disease, of course, a lot of doctors, if you have, things like fibromyalgia, and you have lupus, and you have joint pain, and they don't want to mess with you, they say, you might have Lyme's disease, and, who knows what they do for you. Most people are not happy, and I'm sure that's why you're asking for information, because most people are not happy with the result of, quote, treatment for Lyme's disease, unquote. So I would make sure that the antibodies show, you want to find out the IgG, which is the active enzymes, active antibodies to show that there's an active infection with Lyme's disease. If there's an active infection with Lyme's disease, then it's worth treating with antibiotics. They should be given, every day for usually 4 to 6 weeks, very significant doses, and it's very useful to actually take the 90 essential nutrients to support and promote a happy and active immune system to participate in this. Antibiotics alone oftentimes do not do well, especially if people have absorption problems, this, that, and the other. And so, again, I would give them the Mighty 90. This is, again, to support and promote a healthy and active immune system. In addition to the Mighty 90, which could be the Pig Pack or the Pig Pack Plus, I would also throw in some extra antioxidants to help the immune system really become more effective. I would throw in the selenium. For an adult person weighing 150 pounds, 175 pounds, I'd give them 2 twice a day. I'd give them the Killer Biotic, which is a mix of colostrum, which is the first milk from a cow after she's had a calf, loaded with antibodies against bacteria and viruses and fungus. And Lyme's disease is caused by a spirochete, which is a cousin to the syphilis bacteria. But traditionally, syphilis is a sexually transmitted disease, whereas Lyme's disease, the same family of bacteria, is actually transmitted by tick bites. And so antibiotics can work, but they work better if you support and promote the antibiotic activity and drugs with supporting the immune system with nutrition and supplements. And so I would use this Killer Biotic, which again has the colostrum, the first milk from a cow after she had a calf. It has Killer bee propolis, from whence it gets its name. It has 3 herbs and 4 mushrooms, including maitake and shiitake mushrooms, which are all legendary for supporting and promoting an active immune system. Doesn't hurt to throw in the cocogivity, a couple ounces of that a day. Doesn't hurt to throw in the, things like OPCT, which is decaffeinated green tea, grapeseed and red grape skin extracts, and also tomato extracts. It has about 8 different antioxidants in there. And then I like the Beyond Juice. I would have them take 2 of the Fruit FX 3 times a day for a total of 6 a day, and 2 of the Veggie FX 3 times a day for a total of 6 a day. That's going to go through 2 of the twin packs a month of the Beyond Juice. It's very important to stay away from bad stuff to put a strain on the immune system when you're being treated for Lyme's disease. This would include staying away from fried foods, margarines, cooking oils, meat cooked well done, burnt animal fats. It also helps to stay away from smoking and anything that's, again, going to put pressure on the immune system. So it's a process, and if there's pain in the joints, you can use topically the CM cream. You usually get analgesia or pain relief, of either significant or total, within 2 to 5 minutes, which might last for 5 to 8 hours. And if you want, you can take 2 or 3 of the CM Plus capsules 2 or 3 times a day to get 24-hour relief without having to reapply. But it takes maybe 3 or 4 or 5 days for the capsules to kick in. So I like to use the topical cream, CM cream, and the CM Plus capsules at the same time. With that said, give me a call when you find out about their enzymes. I keep saying enzymes, it's their antibodies. The IgM antibody says that they were exposed to Lyme's disease bacteria sometime, and the IgG says, they got an active infection, so they need to know that kind of thing. If they're just being treated because they were exposed to it some years ago, they might have bone arthritis, they might have lupus. And so the nutritional approach will definitely support and promote healthy maintenance repair in that case. Okay, Doug, let's go to callers.
Well, let's head to New York. And Dan, you're on with Dr. Wallach.
Hello.